Phenylephrine is a type of nasal decongestant, and most of us are familiar with nasal decongestants, before we get on a plane or when we catch a cold. Phenylephrine, as a medication taken orally, is absorbed through the gut or GI, or in this case what the FDA found was it really wasn't absorbed very well at all.
We now have compelling, convincing evidence that oral phenylephrine is ineffective at relieving symptoms of nasal congestion.
I feel that this drug in this oral dose should have been removed from the market a long time ago.
So when people are looking for alternative remedies to oral phenylephrine, there is something called Pseudoephedrine, a oral decongestant pill that's sold behind the counter, which is essentially a strong decongestant or constrictor. So it squeezes the tissue and decongests them, but it can also have cardiac effects. So people should be very careful and talk to their doctor before taking those type of medications. Things like saline rinses, whether they are in a spray bottle or a saline mist, can be very effective for cleaning out thick mucus that accumulates throughout the nose, causing nasal obstruction. In addition, we've long used nasal steroid sprays for allergies, but they can also be very effective for acute inflammation as well. Phenylephrine is often contained in nasal decongestant sprays, and they do work, but the warning is you can only use them for 2 or 3 days, because if you use them for longer, they can actually cause a rebound or cause more swelling than what you had started with before. There's a lot of confusion when someone is on the shopping aisle and looking at nasal decongestants. Most medications containing phenylephrine is very clear in the first or second ingredient, so it's very easy to identify these medications. They're not dangerous. You're essentially ingesting a medication that does not work. It doesn't cause side effects, it's not harmful if swallowed, but it just simply doesn't work.